that's the most common type of dementia, but what other type of dementia can we mention?
Well, there's a lot of types of dementia. We actually don't see pure Alzheimer's that often.
Okay.
That just is an understanding that's out there from movies and TV. You can get pure Alzheimer's, not that common. Usually there's also a vascular component. So it's like a mixed type of dementia. You can have dementia that's reversible. So for example, if someone has vitamin B deficiency, what's very common? They have the procedure to lose weight. They get a gastric band. And after, they stop eating for 2 or 3 weeks. If they're not having vitamin D, that can cause a dementia. Now, that's something that can be picked up and reversed with vitamin B. So for example, in the legal nurses of cases I work with, you know, the other side can say, hey, this is due to the surgery. No, because they did have that decline in memory. They had a dementia. They got vitamin B injections. In 3 months, they were normal again. No, that doesn't explain it. That's why the medical records are so important for us. There's vascular types of dementia. What's really interesting is that if you have a traumatic brain injury, that increases your risk of getting dementia, and it increases your risk of getting Parkinson's disease.
That's interesting.
So you're an attorney. What does the attorney do? The attorney is advocating for their client. They want to help their client be compensated for damages that occur. But what's happening down the road? So it is important, if we determine that a head injury occurred, that in educating the jury to understand this person is at risk for getting Parkinson's disease. They didn't have that increased risk before the car accident.
I see.
This person is at risk for getting dementia. They did not have that increased risk before they had a head injury. One of the things you said that's very interesting is that I've been doing this for, over 30 years.
Yes.
When I train residents at Cornell Medical College, right? So Ivy League medical school. When I train residents there, what they learn now is not the same as I trained them last year, let alone 30 years ago. Information is changing. So I think it's very important for counsel, attorneys to understand this is a changing field.
Yes.
And what type of tests that we use now may not be what we're using in 2 years from now. So it's very important that they're getting counsel advice from the legal nurses, from the